Hello everyone, welcome to Doctor Story. I am Anchal Arora, a digital consultant at MyCare. There's this common complaint that affects people of all ages, knee pain. And to help us relieve this pain, or at least enlighten us how to, today we have with us Dr. Senthil Kamal Shekaran, a senior orthopedic surgeon with more than 25 years of experience heading Chennai Ortho Clinic. After completing his master's in India, he finished his postmaster fellowship in knee surgery from London. A warm welcome, doctor, and I hope you had a fantastic start today.
Thanks a lot, Anshul, and that was a very short and nice introduction.
Most welcome. Firstly, doctor, could you please elucidate causes for the knee pain?
Firstly, our knee joint is one of the most worked joints in the body. Right from the time we are born to the time we start walking, running, and right up to the old age, we just walk. And we run, we jump, we do all activities. And so the knee joint happens to be one of our main joints for locomotion. Saying that we have only two knee problems become a major issue once we start getting pain in the knee. And because of that, we need to look into the causes of knee pain, and we need to identify it early so that we can prevent any further problems before they start affecting you.
Right.
So we do have a lot of causes for knee pain. Mostly the pain which occurs in the knee is an pain which we call idiopathic pain, because that's the main reason why people start having it. It's something like a genetic thing. Some people are overweight, some people are born with problems in the knee, those kind of things. So, but the main concern for us is something which we can prevent, and that would be something like which you call secondary causes for arthritis of the knee, like falls, cartilage damage, and injury, and these kind of things can aggravate problems in the knee and make it worse.
Can overweight also be as a cause of the pain?
Yes. If you see, there is the thing like in physics, like if you have more pressure going through a shorter surface area, then the weight and the everything going on top of that is more, and it kind of wears out the surface. So in the same way, if you are overweight and the amount of pressure going on a small area is high, the cartilage damage is also very much higher. So a thin person will not damage his knees in comparison to a obese person. So in that way, I would say that obesity plays a big role in preventing knee pain.
Right. So what can we do for the knee issue in the young? Like we have people who are into athletics, cardio, they're jumping, running. If those people have knee pain, what can we do?
Yeah. So if you have a young person with knee pain, and if they are involved in sports, we need to first make sure if they have not injured themselves. So if they've injured themselves, then we need to look into the problem of the injury. Like we have to investigate them and see, like probably do x-rays, MRIs, and other things. Sometimes if you have a young person who has a kneecap which is sitting much higher than the regular position, then they can have problems in the kneecap, and that will prevent them from doing deep squats, knee bendings, cross-legged sitting, other things. Other set of people are there who would have twisted their knee. They might have a ligament injury. They might have a meniscal cartilage. And the meniscus is a cushion, like a shock absorber between the knee. So sometimes when you twist your knee, these cushions can get torn. And sometimes they can present with pain on the inner side of the knee or the outer side of it. These need to be picked up early so that we can offer them the right type of treatment for that. So we have problems in the kneecap, we have problems in the joint, and these need to be identified in the young so that we can give them the right type of treatment.
Thank you so much. And for the mid-age, are there any precautions for people to avoid this pain in future if they are in the mid-age?
Yeah, that's a good question, because if you prevent the pain in the middle age, then you can prevent the pain going on to your older age. So what we need to do at the middle age is we need to take care of knees properly. By that, what we can do is we can exercise well, we can keep our weight on the lower side, eat nutritionally, and also what we can do is avoid certain movements of the knee joint. By that, what I say is avoid any kind of squatting, cross-legged sitting, and stack climbing. Many people think that stack climbing is good at this age because it helps to lose weight and other things. But by doing stack climbing, you are putting your knee through a steps. If you have small steps, it's fine, but some of the steps are not always small, and they are a little bit higher, and that can put enormous pressure onto your kneecap and your knee joint. So many people in the middle age, if you take care of these things, then the chances of getting arthritis in the elderly age group is much less.
And what if the person is in old age and is not keen for surgery? What treatment is suitable for those people?
Okay, nobody wants to go through surgery. Everybody wants to stay off surgery. So
Right.
if you don't want to go for surgery, then you need to take care of your knees very well, especially if you're younger and in your younger age and the middle age. Now, I've become like, if you say that I have come to my 60s, early 60s or 70s, and and my knees are getting worn out, I would say that, look, your knee is meant for movement. You have got a joint which is covered by cartilage. Like how you have a car with a tire which travels, and at some point the threads get worn off, you need some kind of replacement at some point of time. But if your threads are worn out and it's still in perfect good condition, then with a little bit of oiling of your knee, then it can get better. So what is this oiling of the knee? Well, we have nowadays lubrication injections, which we call hyaluronic acid, and these injections are given into the knee joint and they form a coating around the cartilage so that the underlying bone, which has the pain fibers, are not exposed, and you can go with your activity without any pain. At once upon a time, we used to give steroids into the knee, but nowadays it's moved on to hyaluronic acid, which kind of lubricates the knee joint.
So this is for those people who have the cartilage problem and have the knee pain because of that, right?
Yeah, because of cartilage wear.
Okay.
But if you have a younger person who has hurt his knee and he has a chunk of cartilage which has come off, we do have techniques by which we put a camera into the knee, have a look inside the knee joint through the keyhole surgery, and we look at the cartilage which is gone, and we have other techniques like platelet-rich plasma, which we call biological therapy. So we take the patient's own blood, we mix it with a bit of fibrin clot, and we give it right into that area of the cartilage loss so that will regrow as cartilage.
So there are many people who, just to avoid visiting doctors or maybe because of some fear of treatment or medication, they do icing or sometimes fermentation at home. So is icing and fermentation, that is keeping the hot pad or heated electric pad or hot bottle, the right way for treatment? And if yes, how does one choose between the two? When to do icing and when is fermentation right?
If a person has had an acute injury, so if you've gone and fallen down and you come with a swollen knee, for them ice packs is good. So within the first 24, 48 hours, ice packs are good. Whereas if you have a situation in which you have been having the pain in your knee joint for a longer period, then for those people, a warm pad or any kind of like how you say any kind of a warm support can kind of help the knee alleviate the pain.
This would be a temporary treatment, right? It can't replace visiting the doctor and getting it checked actually.
Yeah, the foolproof method is to go see your doctor. You have a fall, go see your doctor. If you have pain for a long time, go see your doctor. But in the meantime, if you have a little bit of stopgap time, and rest it, ice it, elevate it, and try to offload your knee. So if you have an injury, don't put too much pressure on it, just in case you might cause more damage. Go see your doctor and then get x-rays, get investigations, make sure you've not missed out anything, and then go to the right mode of treatment.
Exactly. So another common complication we observe with people is knock knees. How can that be corrected?
Okay, knock knees is a good question, because knock knees usually comes as a problem in childhood. So many people come in childhood with their children kind of having a little bit of a kind of, say something like a duck walk, and
Right.
they are very concerned whether this thing. So usually what we do is we check your intermalleolar distance. So we keep checking the child, the distance between the ankle bones, right thing. So we just monitor that. And many of the children, by the time they grow on to the adolescent period, they grow out of it. There are just, however, a very small, minute percent of children who do not grow out of it, and for them they get x-rays. And if you have any problems in the growth cartilage or in the growth physis, which we call the growth physis, then we as orthopedic doctors, we go and try to fix it for you. So that's one thing. However, if you have the same problem in the elderly age group, people with knock knees, then the problem is secondary to wear in the outer compartment of the knee. Normally, if you have an old age person, the wear is in the inner side of the knee and they walk with a bow leg. Whereas if you have an elderly person with a knock knee and having knee pain, then the wear is more in the outer aspect of your knee. So we need to look into that and obviously correct it. There are different ways of correcting a deformity. So if you have a person with the knock knee and the person is young and they want to look prim and proper and cosmetic, and then they are not happy that their knee is there, then we do corrective osteotomy for them. So we do a surgery in which we actually take a wedge off and make the knee straight so they can get better. So that is one way of treating it. However, if the person is not young and they are on the elderly side, for them, we do give an option of a knee replacement. And in that, we can actually do a correction by taking the right amount of cuts. When we're taking the cuts, we make sure that we take the angle of the cut in such a way that we can actually give them a straight knee. So that's two kind of ways of treating knock knee.
Is it good for, like, the earlier you diagnose that your child is having knock knee, the better it is to visit the doctor ASAP, because with time it would
most of the children grow out of it. So unless you have a child who's having pain and not able to grow out of it, and your deformity is getting worse, then you need to be careful and then see your doctor.
We've also received queries about different types of knee replacement treatment. So could you shed some light on that?
Yeah. So there are different types of knee replacement treatments. Okay. So we have the primary knee replacement and then we have revision knee replacement. So the primary knee replacement is for people with old age who have had a knee problem and they have gone through to their doctor or their orthopedic surgeon and they have advised them to go for a knee replacement surgery when the cartilage is worn out completely. Okay. The revision knee replacement is for those who have already had a knee replacement and have had problems in their knee because of either there can be a maltracking in their kneecap, or they can be having features of infection, or some people may have a fall after the knee replacement and had a fracture near the prosthesis, or it could be because of overuse over a period of time and your prosthesis has started getting loose, which you call a loose primary knee replacement. So for most of these kind of conditions, we do a revision knee surgery. So we take off that, we give them a new prosthesis. So these are two kind of things. On the primary knee replacement itself is sometimes if a younger person has wear and tear only in the inner side of the knee and he says, I don't want a full knee replacement, we do have something called a partial knee replacement, in which case we change only one side of the knee, which is called a unicompartmental knee replacement. So these are three types of things. Apart from this, for the type of person, we have a knee replacement. So if you're a woman and you want a proper knee which is fitting, because women and men are not same always. Like if you see a woman, they put out their arms are at a slightly wider angle. The same thing with women. So we have a gender knee. So in the gender knee, we are able to give exactly the fitting for the female profile. So that is one kind of knee replacement. We also have cemented knee replacement. We have cementless knee replacement. So normally when we put a prosthesis in, we kind of take the cuts in such a way where we kind of coat the bone with the cement and we put the prosthesis inside. So nowadays, there are different kind of prosthesis where the attachment is in such a way that we don't need to put cement. Still coming into the market, but it's there. And apart from that, we do have minimally invasive knee replacement where the incision is much smaller. The other things latest coming in is robotic knees. So navigated knees, robotic knees. So these are the latest things. So these are the different types of knee replacements available. But the bog standard is go to your doctor and see him and find out which knee replacement he's comfortable with and go for that. And then you'll get the best results.
Right, because as you said, it's very customized and individualistic with each
It
of
is
them.
individualistic. It is individualistic. And also nowadays we have different materials. The materials keep on changing. So we have titanium. We've always been using cobalt chromium alloys. Now titanium has come in. A lot of other materials are coming in. So these materials also play a big role in giving you a better result. Okay.
It's more like you're building, constructing a building and you have to decide so many things.
Yeah, that's it.
Okay, so
When
what
you start
would be
talking about cement and mortar, you started thinking about the building.
Exactly. So what would be the latest treatment for knees? Is there, any treatment with which one can avoid surgery? Or do we have some, magical injection and get better? Just get better
Yeah,
and
that's
not get
the
into
best
surgery.
question of the day. That's the best question of the day. Yeah. We do have something which has come into the market, which we call biologics. Okay. This biological treatment has always been there for rheumatoid arthritis when people were using only tablets and all. And now we have started using injectables for rheumatoid arthritis. So like how I was telling, there are two types of arthritis which mainly affect the knees. One is osteoarthritis and rheumatoid arthritis. Rheumatoid arthritis affects all the joints, affects the small joints, and they have early morning stiffness, those kind of things. Osteoarthritis usually progresses over age and mainly affects the mobile joints like the knees and hips. However, the elbows and other joints can also get affected with arthritis, including the spine. Once you have knee arthritis and you're having pain, what we can do to prevent it in future is that's to prevent surgery and to prolong your knee is the use of biologics. So nowadays, what biological solutions are there are, one is the main thing is platelet-rich plasma. So platelet-rich plasma is that magical fluid you're talking about, or stem cell fluid. Okay, so this platelet-rich plasma is your own blood. So platelets have always been having this kind of factors, which actually growth factors, which help to prevent inflammation and help to regrow the tissue structures. Right. So they actually like proteins. Okay, so they make sure. So that's kind of thing is so this platelet-rich plasma, when we give it, we take your blood, we centrifuge it, and we get like 4 to 5 ml of this magic fluid. So once this fluid is given into your knee, these cells will go to those areas which are deficient in cartilage tissue and help to heal it. So they are healing, they have potent healing potential. So this wear and tear and other things get better. I'm sure you would have heard about platelet-rich plasma being given for hair treatment. They give it for nowadays in cosmetics for the skin, those kind of things. So it's the same kind of thing, the same principle which is being used to regenerate the cartilage inside your knee.
Wow, such a relief.
It's also being used in certain places, like when you have the cartilage tear. After we've repaired the cartilage tear arthroscopically, we take your platelet-rich plasma and along with mix it with a bit of fibrin clot and we leave it there. So nowadays we leave it inside that so that the healing happens faster.
Wow, amazing. lastly, talking about the health food, what according to you are the 3 superfood for knee health?
3 superfoods. I would say greens, nuts, and probably having semi-skim milk. Semi-skim milk. So those kind of things will help. So basically, anything with rich in calcium will help your knees. The more important thing when I talk about calcium is in women. When you have people of a middle-aged group who are going into their menopause, or you have a younger woman who has had to have their uterus removed because of probably say heavy bleeding and all those kind of things. So in those people, we have to supplement them on calcium. So once this calcium has been supplemented, then the chances of wear and tear will come down, because the uterus, which is the main conserver for calcium, is you have the estrogen receptors, which helps to conserve the calcium. And once the uterus is removed, these receptors are lost. So to prevent people going for osteoporosis and other things, we have to supplement calcium for them. So having a good calcium rich diet is very important.
Noted. With this, it's time to end this discussion. It was indeed a very insightful talk with you, Doctor. Thank you so much for joining us.
Yeah, thank you for having me over. Yeah, take care. Bye.
And for all those watching us online, on which of the topic would you want us to discuss with leading doctors? We would love to hear that from you in the comment section below. For now, thank you so much for watching. God bless, and we will see you in the next video.